So how can commuters stay safe with this new rule from the government? Let's hear from former Health Secretary Dr. Manuel Dayrit. Thank you so much for joining us, Dr. Dayrit. First of all, isn't the one-seat-apart policy for public transport a huge risk, which could lead to a new surge in COVID infections?
Well, actually, Rico, you can manage that one seat apart. If you do, as we've said, the 7 commandments, wearing your face mask and your face shield, no talking, no eating, you can manage that risk very well.
But the last time this was discussed, Dr. Dayrit, the president gave the thumbs down to this policy. What made the government decide that it was time to implement, given that the COVID cases are still in the thousands?
Well, Rico, I think we can say that firstly, when the president put a thumbs down, that was about a month ago. But what has happened over these last 7 to 8 weeks, particularly in NCR, is that cases have been going down. So this is a good time to open the economy. Number 2, I think the president sensed that there are other ways of reducing the risk aside from physical distancing. And this is scientifically proven. This physical distancing rule was actually made very early on during the pandemic, sometime in March and April. But during that time, we didn't know the effectivity of masks and face shields. Now we know better. Therefore, we are combining masks and face shields, no talking, no eating. And by combining that, even if physical distancing may not be according to the 1 meter as prescribed as early as April, then we are reducing the risk as well.
So, Doctor, is this really proven? Because according to the government, they referred to your study, and this is based all on science.
Yes, Rico. It's very well grounded on science. In fact, there was a study in June, okay, of 172 studies on physical distancing, on masks, and on face shields. What they did, and they call it a meta-analysis, is they gathered all of these studies that looked at these different interventions. For face masks, for example, they saw that face masks reduced the risk of infection by as much as 6 times. So if you're wearing a mask versus not wearing a mask, you're 6 times more protected. If you're wearing a face shield as opposed to not wearing a face shield, you're 3 times more protected. Now with physical distancing, if you're having physical distance greater than 1 meter, you're about 5 times more protected. But these were all independent studies, you know, just physical distancing, just face masks, and just face shields. Now what we're doing here is that we're actually combining all of these interventions. So cumulatively, you should have a very, very good effect.
So, Doctor, with the implementation of this latest one-seat-apart policy based on science, and as you say, the infections are now in the lower thousands, is Metro Manila headed towards modified GCQ soon, or maybe by as early as November or December?
If the trend continues, and we have negative growth of infections, meaning to say Metro Manila still has infections, but it's going down, I think optimistically we can say that yes, by December we hope to open the economy by 75% or more.
Thank you so much for your insights and for joining us on The Final Word, former Health Secretary Dr. Manuel Dayrit.